The patient will tell you, "Can you speak louder, honey?" They will. They'll actually yell it out loud because they can't hear you. So you have to make sure you communicate at a good tone of voice, at a good pace, not too fast, not too slow, because we need to have all the patients understand you. So your interaction in the pharmacy is we need to maintain professional and appropriate interaction, which involves being respectful to others. At all times, we have to be respectful with patients and with our peers, with the pharmacist and the pharmacy technicians. We have to be respectful of other people's ethnicity, especially working here in Los Angeles. We have, so many people from many different places, and we need to be able to work with them and to not be disrespectful, regardless of their ethnicity or their culture or their age or their gender or religion or their lifestyle or their economic status. We will have patients from every direction coming to your pharmacy. Sometimes they dress a little funny. When I worked at the pharmacy, there was one patient. He would always come to our pharmacy, and he would bring sort of like this fruit of the loom hat with the fruits and the banana and the grapes and the whole thing, the whole gear. It was all the way up to here. He would come to the window and to get his medications. And now we don't laugh. We don't treat him any differently. We just treat him respectfully and help him with whatever needs he has, which was maybe dropping off a prescription or picking up a medication, or if he had a question with the pharmacist. So we have to be friendly but professional in every sense. One thing that this reminds me of is that working in the pharmacy setting, there's sometimes some controversial items that patients may pick up at the window in the pharmacy. One example is Plan B. Plan B is, I guess you could say, easy way of putting it is the morning after pill. So when a lady has intercourse, unprotected sex, she may get pregnant, and what they do is the next night they come to the pharmacy and pick up Plan B. I think it costs somewhere like $50 some per it's a few pills. Or it's one pill. So you may have patients coming to get Plan B every 3 days. A young girl, maybe, and she's 18, 20, maybe, years of age. She may be constantly coming to the pharmacy to get Plan B every maybe Monday morning. And I say it because I used to see it sometimes. Now, should we make any remarks? Should we make judgments? Should we ask her why is she doing that? Or she shouldn't be doing that, etc.? Well, one of the other things in pharmacy is we cannot make remarks to patients or make comments, judgmental comments. We can't to ask her why is she leading her life the way she is. We all have a different belief system, and we have to respect theirs as patients. And that's part of being professional in the pharmacy when we interact with patients. So this is just the one-on-one interaction, and this is interacting in your group in the pharmacy setting. It would be with pharmacists and pharmacy technicians that work with you. Employee growth. Employers want to usually know that their employees have goals and they're looking to continue to pursue their education in that field. For us, it would be pharmacy technician. So therefore, goal setting is important. And on a personal note also, and this is for your future as well, it is always good to set goals and monitor their growth to see, are you getting closer to your goal, or are you somehow gone way on the other end and you've gone a completely different direction, and do you have to recenter yourself and continue to pursue your goals? So goal setting is important. A goal is the desired result or purpose. A long-term goal may take a few years or even a lifetime to accomplish. I'm sure we all have a few thoughts in mind as far as long-term goals. A short-term goal. These are smaller steps taken to help reach the long-term goal. It may take a few days, a few weeks, or months to accomplish. For all of you that are here in the pharmacy technician class, I know that one of your goals, because you're sitting here, is to get your pharmacy tech license and to become certified, because for certification you have to take an extra exam, and we're trying to prepare you to pass that exam. So this basically pharmacy technician would be considered a short-term goal. You started the class in August. We're now in almost in October. In 2 weeks, you guys thought it would never come, but it's here. In 2 weeks, you go to your pharmacy tech externship, and so you're getting closer and closer to the goal. And by the second week in January, you will have completed the program for the pharmacy technician. In the meantime, I have already mailed out your application to the Board of Pharmacy, and your license should be arriving probably towards the end of January. So that's an example of a short-term goal. Maybe it lasted about 5-6 months, all right, for some of you. Now, it's important because in 6 months after January, I will no longer see you. You will have moved on with your lives, and you will continue to either work in a pharmacy setting or in a different setting, or you may maybe continue to go to school, pursue a bachelor's, a master's. If you want to become a pharmacist, maybe you'll go that direction. But very important for all of us is to have goals and to write them down. They say if you don't write a goal down, it's as if it's never going to happen. So what we're going to do is an activity that I feel it's very important, because especially you guys are all very young, you're all in your early 20s, and whether you want to work in the pharmacy setting, that's fine, or you maybe, some of you actually in this class have aspirations of becoming a nurse, an RN or an LVN, a physician's assistant, even a pharmacist. So those are probably all longer term goals. Whatever your goals are, we are all free to decide, what we want our life to be like. And the best way to do it is by planning it, writing it down. And we're going to use what we call, we're going to make our goals SMART, basically. So your goal has to be specific. So you have to know specifically what you want to attain. For example, if you want to go to pharmacy school, that's very specific. It has to be measurable, meaning how many years is it going to take? What is the next step? I need to go to community college for 2 years, get my AS, transfer to a UC system maybe, and complete my bachelor's, then apply to pharmacy school, which once you get admitted to pharmacy school, it's a 4-year program. So that would be a long-term goal, very specific, and you know the time. Is it attainable? Meaning, will you complete it? Can you complete it? Is it something that you can achieve? And the answer is yes, if you plan and you start doing the research with your college maybe counselor, or you can go to an orientation session at USC School of Pharmacy, and they will tell you all the prerequisites, how long it's going to, what the process is to be admitted, how long it's going to take for you to complete, and what you need to do in order to get to the admittance portion of the pharmacy program, let's say at USC. So now you're going to know very concretely what are the steps that you need to take. And now, thanks to the internet, all you need to do is, if you're not able to go to an orientation session, you just punch in your information, USC Pharmacy School, or pharmacy schools in the state of California, and it pops up. And under each school, there'll be a section where you see all the prerequisites. Now, definitely that's a great tool to have, but I always suggest to students that I advise them to go meet with a counselor in person, because it's just not the same thing as when you do the research is fine, but if you're really serious about it, I think it's best to make an appointment with one of the program the counselors at the programs. That way you really know that, because you don't have time to waste, and you don't have, most of us anyways, don't have all the money in the world or all the time in the world. You know, if you want to become a pharmacist right now and in 15 years you become a pharmacist, well, that's a long time. And I'm not sure that you want to do that for that long. So instead, if you plan right now, you know that within about 8 years, maximum 10, you will become a pharmacist. Or you faster, you know, depending on how many classes you take in maybe your work schedule and your family. So let's see, and is it relevant? So is it important to what you want to achieve ultimately? Number one, I think the first thing is to realize and recognize and ask yourself, is this goal something that I want to achieve, or is it something that someone else wants me to achieve? We can all take our different steps throughout our life, but I think the most important decision, especially because this would be a big decision if you decide to become a pharmacist, is figure out if you like what you're doing, if it's going to make you happy. And yes, pharmacies do make a lot of money, pharmacists. I think right now in California, average $120,000, possibly. They make a good living. So first, I think it's also good to do the legwork, which you're in a way doing it right now.